Troopers say 84-year-old Lois Phillips drove the wrong way for about a mile.
Okay, were you feeling confused or something?
I didn't think so. I think I may have been going the wrong way. I'm not sure.
Motor vehicle crashes are responsible for thousands of deaths and millions of injuries each year. In addition to drivers impaired by alcohol or drugs, and those impaired by distractions such as the use of cell phones and texting while driving, medically impaired drivers are becoming an increasing public health concern.
Welcome to Graceful Aging. I'm your host, Gregory Bader. Today, we're going to deal with a very important topic for all of us. Not just one group, but for all of us. And I'm so happy to have just a fabulous guest, an expert, Professor Dr. Bonnie Dobbs. Is it professor or is it doctor or both?
It's both.
Okay.
Thank you, Greg.
You are from Canada, and you are from Edmonton, and you are from the University of Alberta. Your expertise in a program you've developed, I think, is so important, and it relates to driving among older adults and dementia, the onset of dementia. Describe your program briefly for us.
Thanks, Greg, and again, thank you for your interest in this area. We know that the incidence, the number of new cases of dementia, and the overall prevalence of dementia is going to increase significantly in the next 2 to 3 decades. And that's due in large part to the aging of the baby boomers, my cohort. Having said that, we know that in the United States, for example, there's about 13.5% of the population 65 and older that has dementia. In Canada, it's about 11%. A significant percentage of that population is driving. And we know that with a illness such as progressive dementia, Alzheimer's disease, it's not will driving become impaired, it's when will driving become impaired. One of the really important considerations in terms of driving and dementia is to not make decisions about licensing or retention of the licensing on diagnosis alone. In that if you look at the data, about 2/3 of individuals in the early stages of dementia are unsafe to drive, but 1/3 are still safe to drive. So if we revoke licenses based on diagnosis alone, we're unfairly penalizing that third.
It's not a clean-cut issue like that. You know, there was an interesting point that you made this morning that presently, to give people the idea of how much more our society is going to experience dementia, is now what, every 5 minutes, roughly, a new case of dementia is diagnosed, and going out 30 years, 40 years, how is that going to change?
Every 2 minutes. And the reason that driving is such an important issue in the course of the illness is that we know that in North America, in particular, a license is associated with independence and mobility. Sure. Revocation of driving privileges means that the person doesn't have the independence or the mobility. And for the individual with dementia, it's a significant loss, it's a stressor, but it's also a stressor for families, for caregivers.
You really need an outside person who has no interest. I don't want to tell him that he can't drive and that I think there's something wrong with him, because he'll get angry, and that, of course, is the crux of the matter. I wanted someone else to make that decision. He wouldn't then not blame me, but think of me as being the bad guy. Someone else has to be the bad guy. The spouse or the caregiver can't.
And you know, at least if there were to be at some point regulation put into place, it takes it away from the responsibility of the family to have to enforce such an action. And it's much easier when you have, you know, some outside body, some governmental body who says you must do this or it must be done this or that way.
Yeah.
And any of your family members that are watching the program today that has a family member, a relative with dementia, understands if they're struggling with the driving issue. One of the difficulties, the tragedies associated with an illness such as dementia is it robs the individual not only of their ability to drive, but it also robs them of their insight. And that's why the issue is so difficult for caregivers.
Well, I'm on schedule to get my license back now, and I feel very confident, and I am feeling better.
But once we get in the car, I mean, it's always the same issues. I mean, explaining to him why he isn't allowed to drive is just, it's daily. We explain it daily, and sometimes we get a little frustrated. Oh, I put the club on.
I've been driving all my life, and I still feel that I can drive, although the doctors have restricted me from driving. It's a very objective, I really object to not being able to drive. And I feel that I see some people out there driving that are not as good a drivers as I am, and they still have their license, so I complain about it just about daily and just about hourly.
An illness such as Alzheimer's disease, it affects not only memory, but it also affects judgment, decision making, and so many of the cognitive abilities that are needed for driving are affected early on in the illness. And so it's very important, again, for us to make decisions about driving based on the declines in functional abilities needed for driving. But once the illness has affected the person's functional abilities, I think that it's really important from both a individual safety and a public safety perspective that the individual makes that transition from the behind the wheel into the passenger seat. So moving from the driver's seat to the passenger seat.
Daily he wants to go talk to the police. He's daily at registries. He walks over to registries to find out the status of his license.
Can I have your ID, please? What status are you suspended or?
Well, I think perhaps I've been suspended, but I'm just wondering.
For what reason?
For health reasons.
Health reasons? All right.
Yes.
Can you tell me what your address is? Yes, you are. We can't do anything for you. You do have to contact license enforcement. I'll give you their phone number, and you contact them, and they'll tell you exactly what has to be done.
Okay, thanks
All
very
right.
much. What does it say on my license right now?
Right now, you're not supposed to be driving, sure at all. Okay, you are suspended for medical conditions.
His family doctor is the one who actually, with all the doctors that my father has right now, I mean, I guess they've all just kind of decided to pull his license. So his family doctor is actually like the head guy that gets all the information. So my dad wants to go see Dr. Adams, that's his doctor, every day to find out if he, why he took his license away.
And one of the things that I very much want back is my driver's license, but I do believe I have to have your recommendation and your thoughts on my ability to drive before I'll get it back.
That's correct. He's been doing this for the last probably 10 months. And he comes in about once a month, and so now he's starting to get that urge again to, I'm feeling better, I can do better. But when I talk with his family, he's not doing better. When I talk to his other doctors that take care of him, no, he's not doing better. But if I take away his hope, then I've just taken away his life.
I know I'm improving each day, and
that's why we have gone farther now in making sure that, because you continue to improve, that's why we've said, if you're still improving, the better way to do it is to make sure that you get to that plateau that you're, hey, I feel confident now, I feel like I can do something, and then try it.
Yes, I agree with that, and I'm not going to go for the test even today because I don't have any pressing reason not to do it for a week or two, and I feel that I'm still improving each day.
That's good.
And my analogy to that is that if we have someone that is impaired by alcohol, we wouldn't, as a society, allow them to drive within a 5-kilometer radius of home, or we wouldn't allow them to drive
Which is
between...
roughly, what, 2 miles?
Exactly.
Okay.
Or we wouldn't allow them to drive between 10 and 2 in the afternoon. So often we hear families, we hear the medical community, we hear community-based agencies talk about that we can help people in the early stages of dementia retain their mobility by using restrictions such as only allowing them to drive within 5 miles of home.
Oh, is that smart?
Yeah, and it's not smart because, again, if you think about it, would we allow an alcohol-impaired driver to drive between 10 and 2 in the afternoon?
Crazy,
and
yeah.
the difference between the alcohol-impaired driver and the driver with dementia is the alcohol-impaired driver may sober up. Mm-hmm. The individual with dementia, their cognitive abilities are unlikely to change. In fact, they're not going to change significantly. In thinking about it, one of the reasons from a societal perspective, from a family perspective, that we think about those solutions or we generate those solutions is because of the importance of mobility, the importance of the independence that a license gives a person.
Even though he has a lot of memory loss, the one thing he doesn't forget is that he can't drive. I mean, it's such an emotional attachment, him and driving. I mean, that's his independence, that it's just, he's never let go of it.
There's something about not getting around and being active implies that a person's less than a man.
And so we want to allow them to stay mobile, but I think as a society we need to shift and say, okay, we'll allow them to stay mobile, but we'll allow them to stay mobile through alternate means of transportation. So allowing someone else to drive them so that they are safe and there's safety guaranteed to the public.
You know, and the safety is really one kind of the very dark side of all of this is that the crash rates for someone with dementia are skyrocketingly high, aren't they?
Yeah, if you look at the data across studies, individuals with dementia have crash rates that are 2 to 8 times higher than individuals without dementia. And again, we know that it's not diagnosis alone, but as the dementia progresses, a progressive dementia like Alzheimer's disease, again, it's not will driving become impaired, it's when will driving become impaired.
So some of the problems we had as physicians in completing driver's medicals is that we've never had a good objective way of trying to detect cognitive difficulties that may be affecting somebody's ability to drive safely.
So it's critical from the medical community perspective, from the societal perspective, that we identify drivers with dementia, we assess them using evidence-based tools, and if their driving skills have declined to an unsafe level, then their license needs to be revoked. And I know that that's not politically
it's a harsh
popular.
A harsh sounding statement. Because we have had a number of shows, and our approach on graceful aging is to try to have older adults stay independent and remain driving for as long as possible and overcome their functional problems. But when you get to the issue of dementia and a medical condition occurring, that kind of becomes the exception to that gold, isn't it?
Yeah, absolutely. When we talk about or advocate for keeping seniors on the road for as long as possible, I think we're thinking about the healthy, well senior,
right.
And that makes perfect sense. But if you look at the senior population, it's very heterogeneous, and within that population we have our healthy, well seniors who should be behind the wheel if they're comfortable and if they're healthy. But then we have a group of individuals, such as a progressive dementia, where if they're not safe. And what we need to do as a society is we need to put the programs into place, first to help them make that transition from the driver's seat to the passenger seat, and then we have to help them stay mobile.
Well, before we get to those, just to score the point one more, when you mentioned a 2 times to 8 times higher chance of having a crash, that gets coupled with individuals with Alzheimer's may be more fragile, and the death rates in those crashes are much higher as well. Consequences for one of those crashes really go far beyond the driver who shouldn't be driving anymore.
Yeah, absolutely. A very good example, and it's a crash that occurred that attracted a lot of media attention. Many people will be familiar with it, is the Santa Monica Farmers Market crash a number of years ago.
An 89-year-old California man mistook his gas pedal for the brakes and plowed into a crowded farmers market, killing 10, injuring 63 others.
And Mr. Weller, the driver, was 86 years of age. He propelled his car 2.5 blocks through the farmers market set up in Santa Monica. 10 people were killed, 76 people were injured. And in reflecting on that crash, I think that there were many victims. There were clearly the people who were fatally injured, their families were victims. The individuals who were injured, their families were victims. But Mr. Weller and his family were victims as well. Their lives were changed forever that day. At sentencing, it was revealed that Mr. Weller had a vascular dementia. Interestingly, in the police investigating the crashes, there was evidence that Mr. Weller had run into his garage a number of times. He had run into his mailbox a number of times. Mr. Weller had a crash about 8-10 minutes prior to the Santa Monica crash. The tragedy, I think, is that no one took the time, or no one was brave enough to have the difficult conversation with Mr. Weller. I wouldn't want any family, and I can't imagine any of your viewers that would want their parent, their mother, their father, their spouse to be a medically impaired driver and to be responsible for injuring or fatally injuring another individual.
There is that difficult conversation. And, you know, interestingly, just recently there's been a lot of news about, with the change in the diagnosis, that once it's diagnosed, Alzheimer's has really been around probably quite some time. So how does a family know when to have this conversation and with the driver about restricting or taking away their privileges?
Yeah. My perspective on it and my experience in dealing with individuals with dementia that have attended our support groups is the earlier the conversations, the better. And having an early conversation, or having a conversation early in the course of the illness when the individual is more cognitively intact, empowers the individual in that they can be part of the decision-making process. It can help them to start preparing for the day that it's going to happen. Chances are that when their license is revoked, they may not be as aware of it as they would a healthy, cognitively intact individual.
You know, that's a good point. I would imagine if you have these conversations quite early, and you might know it from your family history or smaller signs, I can't believe that any person would want to expose the world to death or injury and their family to the guilt that might come with that and just all of those consequences. That's an interesting point.
Well, and in fact, as a follow-up to that, I think one of the things that's interesting is the early conversations for the families, the early conversations for the medical profession are really important, because when the person is in the early stages of the illness, when they still have many of their cognitive abilities, they will agree that when the time comes, when their skills have declined to an unsafe level, they absolutely would not want to be driving.
I figured that maybe something was wrong. So when I went to the doctor and he finally gave me the the word that I had Alzheimer's, that he advised me not to drive. I reconcile myself to the fact that it's not safe for me to drive, and I follow the doctors. It would be criminal for me to drive now.
But I would imagine that that's an important marker that you can set in an individual's brain to come back to later when maybe their cognitive abilities have declined. Because these are some difficult conversations, and I want to talk to you more about how people get through and the family struggle on taking away the keys.
It's very difficult because you don't know what's the right thing to do. And, you know, I mean, I told my mom, I says, Mom, just because you can't drive doesn't mean it's the end of the world. I felt bad for my mom, and I just felt that she didn't trust me.
No.
To help her to do the right thing. And I mean, I'm an only child, and I've been there for my mother all the time. I've helped her through many situations. And I said, Mom, you know, why would I want to hurt you? Why would I do this to hurt you? And then she apologized to me. She said, no, I know, you know, that you care about me. But she was hurt and angry, and of course, who do you take it out on? The person that's closest to you. So I just, it was very hard for me as well, because, you know, nobody likes to see their parent go through any difficult time.
Physician, the family, and the individuals to start preparing for the day that driving will no longer be possible.
Well, that makes good sense.
Yeah.
And you mentioned a diagnostic tool. We really don't have time to go into it, but we're going to put up the location that families and community groups and police departments, whoever, can use to access, medical departments can use to access. So that's a fascinating topic and tool that you should take a look at. Here's one thing that people are sitting there and they're saying, okay, Dr. Bonnie Dobbs, what are the words that we should say to Dad so that he'll understand?
First off, we know that those are very difficult conversations, as I mentioned. If you talk to people with a dementia that's had their who have had their licenses revoked, they talk about it as being one of the most difficult aspects of the illness. If you talk to family members, if you talk to caregivers, they talk about the driving as being one of the most difficult aspects of the illness. That to me is just extraordinarily powerful. It suggests to me that we absolutely need to help the individual and the families in dealing with it. One of the things that we have found in our research is that license has both a actual value and a symbolic value. The actual value is that it allows people to go from A to B to C. The symbolic value, which is often not recognized, is what it means to the individual.
Sure.
It is that little piece of plastic is symbol.
It's my passport to the world.
It's a symbol of competency. So from that perspective, and because of the impact of the disease on the reasoning, the judgment, the decision-making of the individual, rather than getting into conversations trying to rationalize or explain to Dad, explain to Mom, or explain to your husband or wife why they can't drive, it's far more productive to say, I'm sorry, we had to do it, but tell me how that makes you feel, and start dealing or addressing it on an emotional level. And you can say, well, let's not talk about when you're going to get your license back, but let's talk about how it makes you feel, and then let's talk about how we can improve your well-being.
She's barreling down the interstate as if nothing's wrong, an 84-year-old woman behind the wheel of this station wagon, oblivious to the oncoming traffic.
It was traumatic, you know. It was It was something I never, ever thought I'd see.
Tim Fleming pulled out his cell phone camera to record the jaw-dropping sight on I-95 outside Philadelphia Thursday, desperately honking his horn, trying to get her attention.
I saw a car swerving around her and she wouldn't stop, and I yelled at her again. She just waved her arm at me, just like, leave me alone.
Amazingly, no one was seriously hurt despite the 4 crashes she caused. Her road trip, a reminder of the dangers sometimes associated with older drivers. As for this confused driver, her family says they've now taken away the keys and the car, and they're keeping a close eye on her.
There now is strong evidence that drivers with cognitive impairment are at risk for declines in driving competence. Cognitive impairment can be caused by many common chronic illnesses, including diabetes, coronary artery disease, congestive heart failure, chronic renal failure, and of course the dementias.
It's very frustrating because everybody is telling the patient with Alzheimer's that they can't remember and they don't really appreciate that. And then it becomes very difficult for patients to understand why they can't drive any longer, and very difficult for families to then figure out how do they go about getting the keys away.
Oh, I put the club on.
I've been driving all my life, and I still feel that I can drive, although the doctors have restricted me from driving.